All right, I want to introduce some of the electrical muscle stim units that we're going to be using for our E-stim scenarios. And this unit here is an EMPI P300. It's a neuromuscular electrical stimulation unit. It's what we're calling the older model. And then we have a newer model that I'm going to introduce here in a few minutes that we're going to be using for at least one of our scenarios. As we introduce electrical muscle stim, we will have E-stim, electrical muscle stim scenarios that kind of run you through using different machines. These handheld units that are often sent with the patient home, or what will have clinical models that will be on a table, very much like our ultrasound units that we introduced earlier in the semester. So on this first one, this is again a neuromuscular electrical stimulation unit, and we're going to use this particular unit for two different scenarios. One for drop foot, someone who might have had a stroke, or someone who's had maybe a localized injury to the lower leg, where they have an anterior tibialis weakness, and so we'll use this unit for that. We'll also use this unit for a patient who's had a CVA or stroke who's got a subluxed shoulder, trying to approximate the joint. So we're going to use the older unit for two different scenarios, and I'm going to show you now how to turn it on and how to set it up. The red button turns it on, and then if you hit set up and keep it on the neuromuscular electrical stim unit, on this little toggle switch here on the right is kind of the enter button. So if you hit that and stay on custom, got to hit the unit, you got to hit the button fairly hard to get it to work. So we're going to be doing what we call muscle re-education, and on this particular one for the drop foot, the time on is going to be 10 seconds, and we've got it set at 10 seconds, but if I wanted to change that, I could by toggling up or down. So we're going to keep it at 10 seconds, then hit the enter button. Our time off is going to be 30 seconds. So again, the patient's going to feel electrical stimulation for 10 seconds, and then it's going to be off, resting for 30 seconds, and then back on. Okay, so keep toggling through in the enter button. Our rate, PPS stands for pulses per second, sometimes is referred to as frequency or the rate. And we want it somewhere between 25 and 35 pulses per second. This one happens to be set at 30, but again, if I wanted to change that to 25, it goes in increments of 5, so I could go back up to 30 or even up to 35, but we'll keep it at 30. If I can get back down there, and then we'll hit the enter button. On this one, you have a choice of symmetrical or asymmetrical. Symmetrical means that on both electrodes, and you're going to have electrodes hooked up to both of these wires, or both of these leads, and so you would have, under symmetrical, you'd have the same amount of current under both electrodes. Under asymmetrical, you would have more current under the black electrode, and so we would put this black electrode over what we call the motor point or the muscle belly. So we're going to leave it on asymmetrical, and we use that pretty much for large muscles. Synchronous, which means that you're only using one channel, so both electrodes will be on at the same time, versus alternating. If you had two or four electrodes, two leads, then it would alternate back and forth. Our ramp time is the time that it takes to go from 0 up to the amount of current that you have it set at, and so they call that ramp, and we want a 2-second ramp. Again, we can change that up or down, but we're going to leave it at 2 seconds. Our pulse width is sometimes called pulse duration, and that's width of the pulse wave. We would like that to be somewhere between 200 to 400 microseconds, and currently it's set at 300, and so that's where I want you to keep it. Our timer is set for 10 minutes. You could increase or decrease that, but that's fine, and that's where we're going to keep it. And now we're ready. So once you have it ready, all you have to do is hit the up arrow and it'll turn on the machine. You can see a little bit of an amber or orange light that comes on, and then we would turn this up and just keep turning it up until the patient feels something. And then on this particular scenario, we want to obtain what we call a fair plus contraction, so a 3 plus contraction. So we actually want muscle contraction to occur, and we would like to have the patient be able to dorsiflex their ankle. Again, this is a scenario where the patient has drop foot, which means when they ambulate, they can drag their toe. And so we want them to be able to clear their toes or clear their foot by dorsiflexing, and we would like their toes to come off the ground and their foot to dorsiflex. So that's what we're looking for. Okay. On the, I'm going to go ahead and shut it off. You have to hold the off button for a bit, and then the screen clears. On the next scenario, very similar to that. Again, this is our scenario is actually a right hemiplegic subluxed shoulder. We're going to turn it right back on. Maybe. There we go. We're going to hit setup, just like we did before. Now we're going to continue with NMES. We're going to continue with custom. On this one, we want 24 seconds on and 2 seconds off. So on here, we're going to increase this to 24 seconds. And we're going to hit next. Our off time, we're going to be at 2 seconds. So not much rest or not much off time. On the subluxed shoulder, a lot of times the patient's having pain, and so this electrical muscle stim is used to approximate, contract those muscles so you have enough tone so this shoulder is not hurting all the time. So we got that set. We're going to hit next. Our pulse rate is the same as the other one. We want it somewhere between 25 and 35. We've got it at 30, so we're fine. On here, we're also going to be asymmetrical, and we're going to put the large black electrode, so we're going to use the black lead over the posterior deltoid. We're going to have it synchronous. Our ramp time is also going to be 2 seconds, so we're going to leave it there. Pulse width is 200 to 400 microseconds, so we're going to leave it at 300. Our timer is set at 10 minutes, and that's fine. This one actually, you may actually have this on longer, but 10 minutes is good for right now. And it's ready. So again, hit the up button, and that'll increase your intensity. On this one, we also want a fair plus contraction. So we want to be able to see muscle contraction, and we want to be able to see the shoulder and the humerus to kind of approximate or move up into the joint, and hopefully decrease their pain of having low tone. In this one, the patient's going to be sitting and comfortable. In the previous one, the person's going to be short sitting with their foot off the ground, so you can actually see dorsiflexion occurring. So those are the two scenarios that we're going to be using this older EMPI P300 neuromuscular electrical stimulation unit for. We only have one of these units, so that's why we're doing the video, so you can watch as I set it up, and you guys will be using this. As we introduce all of them, you'll be passing it around and taking turns using this particular unit. All right, I'm going to shut that one off, and we're going to move on to our new electrical muscle stim unit. This is an eye relieve unit, and it is actually a unit that can be used for a TENS unit, transcutaneous electrical nerve stimulator, or used for the neuromuscular electrical stim unit. I think in here it actually is called an EMS unit. Okay, so we're going to turn it on by pushing the on button. And this one actually has 5 different programs. And Owen has put those together so you can see them. We're going to actually be using program 6 because it matches the parameters that we want for this particular setting. This unit will be used for the one setting. Okay, we are back, and we're going to introduce this, what we call the our newer unit. It's called an iRelieve, and it is a TENS unit or an electrical muscle stim unit. In our scenarios, we're going to be using this newer unit specifically only for the electrical muscle stimulation. We actually will be doing some TENS scenarios, and we'll be using a different unit for TENS, but this is for the neuromuscular electrical stimulation scenario for someone who has wrist extensor problems, and in fact they have flexor spasticity. So someone who has had a stroke and has an increased flexor tone, what we're going to use it is to put the electrodes on the back of the hand for the extensor and to work on relieving or reducing their flexor spasticity and get them into more of a neutral position. So what I want to do is show you how to start and use this unit. This unit doesn't have as many custom parameters as the last unit, if you watch the P300, the MP1. But here we're going to go ahead and turn it on. And you can see it's currently set at 60 minutes. It's on the EMS side, EMS, and it's in program 5. All right, so if we kind of toggle, we get you see the 60 minutes flashing, and you could go up or down, and that's in increments of 5. Okay. Now you see the EMS is flashing, and if I went up to TENS, we could actually use this unit for a TENS unit, but we're going to use it for EMS. Now you see the 5 is flashing in this program, or this particular unit. It has 6 different programs, and so you could start it, and they're all slightly different with different pulse widths, pulse rates. I encourage each one of you, with electrodes on, put them on yourself and feel. As you increase, if you use program 1, it's going to feel slightly different than program 2, as well as program 3. Program 6, the one that we're going to use, again, is closest to the parameters that we're looking for to reduce flexor spasticity. Okay? So we're going to go to program 6. Once you get to program 6, you're going to be able to increase your intensity in doing so. But this particular one will be symmetrical. We're actually going to identify one of these as the black lead. You're going to put the black lead over the proximal wrist extensors, and the red lead or the neutral lead over the distal wrist extensors. And you're going to, once you get it set, you'll increase intensity. Maybe. There we go. So to hit channel 1, we're using only one channel. Hit channel 1 and then increase the intensity. You can see 2, 5, 6. And you're using that until the person feels stimulus. And then again, you're trying to get them to have a fair plus contraction, which means it's not just a visible contraction, but you want them to actually be able to take a little bit of resistance. Okay, fair plus contraction, 3 plus. Okay, and you could set this upwards of 60 minutes. Our treatment would probably be more along the lines of 10. Your patient's going to be sitting with their arm on the table. Okay, done with this one. Just hit the off button and it'll shut off. Okay. Okay. On this last video, we're going to show you how to operate our TENS 7000. This particular model is a new TENS unit. We're going to be using it for 2 different scenarios. One for what we call low rate TENS for bilateral cervical and upper trapezius pain. So you're going to be in this area. And then the other one is a high rate TENS, which we're going to consider that to be a normal mode. And that's going to be for low back pain with right lower extremity radicular pain as well. So with this unit, again, this is a TENS 7000. It's TENS stands for transcutaneous electrical nerve stimulator. Primarily, this unit or TENS units in general are used for pain control, pain modulation. Okay, so you have to turn on the unit up at the top. This one has two channels, channel 1, channel 2, and they are synchronous, meaning that you're going to have all four with 2 leads and 4 electrodes. You can put those around or crisscrossing over the area of pain. On the first one, high rate TENS, we're going to use it on the normal mode. You can see that, okay? If we want to change the settings, so hit mode, modulation, burst, we're going to use burst for our second scenario and normal for our first scenario, okay? Hit setup. We can change pulse width if we want to, and we would like to have it at 50 microseconds pulse duration, so we can change that there, okay? Hit set again. Our rate, again, that's pulses per second. We would like to have that to be at 125, so that's perfect, but we could change it if we wanted to, and we will on our low rate TENS unit. And then our time, 60 minutes, is the maximum time that you can set on this one, but 60 is fine. A lot of the TENS units will have kind of a timer bypass where you can leave it on as much as you want. So once you have it set at the right parameters, all you have to do is turn up the intensity, all right? So it doesn't register on the screen, but you can turn up the intensity until the patient feels a comfortable tingling. And in this one, particular one, you want it to, on the high rate TENS, you want it just to produce a tingly sensation, meaning that they're feeling it, there's no muscle contraction, and definitely no discomfort or any pain. Okay? On the second scenario, called low rate TENS, you're going to be over bilateral, cervical, and upper trapezius areas. And on this one, instead of being normal, you're going to be under what we call the burst mode right there. So burst mode just means that you're going to get stimulus, it's going to be low, and then you're going to feel a little bit more intense, and it's going to feel somewhat different. And the whole idea is trying to reduce that accommodation so the patient constantly feels the intensity. And on this one, you will be looking for muscle contraction. So we'd like our burst mode to be at a rate of 5 pulses per second, and our pulse width to be at 60 microseconds. So here, the rate is actually at 5. There's our pulse width. We would like that to be at 60, so we're going to change that. Hit 60, we want that at 5. We could increase or decrease. We want it, that's 5 pulses per second. All right, and then hit set again, and we want it to be at 20 to 30 minutes on the treatment. So we'll go ahead and go down by 5, down to 30 minutes. So once you have it set where you want it, again, you're going to increase the intensity until, in this particular situation, the patient is going to feel a visible, you're going to see a visible contraction, and the patient's going to feel a visible contraction. So you're going to see upper trapezius and as well as cervical musculature contracting. The patient's probably going to be sitting with cervical support or lying prone with their head on a cervical pillow or within the on the table with their head in the cervical hole. So this one's 20 or 30 minutes. The previous one for low rate or high rate normal setting could be on 24 hours a day if they wanted to. So that's how we use our new TENS units. When you shut it off, then you're just going to shut it off.